Pat Doris. Welcome to The Story. Tonight we're on the verge of another widespread hospital strike by nurses, the largest in Oregon state history, according to the union. It's only supposed to last 3 days, but the fact that it could happen tomorrow morning has us wondering, what's up with hospital finances? Why have they fought unions and insurance companies so much lately? We'll dig into that. It's our big story tonight. Tomorrow morning, as many as 3,000 nurses in the Providence health system in Oregon may go on strike. They want better pay and better working conditions, and they say they've been bargaining for nearly 2 years with no success. Remember back in March of this year when Legacy Health Systems and the Regents, the insurance company, butted heads? Legacy said they needed Regents to pay more for various procedures to keep up with costs, but Regents said they didn't want to pay the hospital system more because their customers would get socked with the bills. At the last minute, the two sides came to an agreement. Last October, thousands of Kaiser Health employees in Oregon joined a national strike against the hospital system. They spanned a number of groups from radiology techs to medical assistants and housekeepers. They wanted better pay and job protections. At nearly the same time, pharmacy workers started a 3-week strike against Kaiser. Okay, so what is going on? We'll take a look at it in a big picture perspective. The system is still pretty much recovering from the COVID pandemic and the seismic shocks that brought to healthcare. And more specifically, hospitals say they are struggling, especially the big ones. Let's do a data dive now. This is from the Oregon Health Authority, which has a dashboard on hospitals. This is for all 60 hospitals in the state. I've selected operating margin to show you here. That means whether or not they made money. It shows us that statewide, it's been definitely an up and down journey, although the hospitals fell below that zero line there on the right side in 2022, then went up a bit, then ended the third quarter $10 million in the red. We can also break them out. This is for the 27 largest hospitals in Oregon, also big trouble around 2022, and ended the third quarter of last year at negative $44 million. Here's a look at small hospitals, 50 or fewer beds located 30 miles or more from another hospital. It shows they came out about $4 million ahead. And here's a look at other small hospitals, still with 50 or fewer beds located within 30 miles of another hospital. They came out on the positive side by $29 million. Again, that's just for the third quarter of 2023. So you can see it's a bit of a mixed bag in there, but no doubt that the big systems are hurting, or were when those snapshots were taken of their financials. Here's one more that I wanted to show you. It's been put together by the Hospital Association of Oregon. See that red line under the 2021 and 22? They argued that without federal relief funds during COVID, the hospitals then would have been in the red, and that they would still be in the red as they are today. Here's Lisa Goodman, the association's spokeswoman.
Hospitals' finances really have been evolving for the last 4 years since the pandemic. Were it not for federal CARES Act funds, hospitals would have faced staggering losses in 2020 and 2021. In 2022, however, when that federal funding goes away, you can really see the impact. In 2022, for example, hospitals collectively posted a negative 2.7% operating margin, ending that year in one of the worst overall financial positions since we first began tracking financial data in 1993. Last year, in 2023, hospitals really only saw a modest improvement in their financial stability, with 54% of large urban hospitals and 52% of small rural hospitals reporting that they didn't get paid enough to cover what it cost them to provide care. So in 2023, hospitals posted a negative 1.3 operating margin. So it was really only a marginal improvement over 2022.
So when we see all these conflicts with insurance companies and unions, lack of money does seem to be a big reason. And why, you may be asking, is there a lack of money since prices are sky high if you ever have to go to the hospital yourself? Well, the Hospital Association says the government does not pay enough for care. They argue that hospitals only get paid 70 cents for every dollar spent on Medicaid patients in 2022, for example, and that underpayment totaled more than $1 billion. All right, we've been talking in generalities, but the Oregon Health Authority's site on hospital finances also does have specifics. So I was curious. I wondered about Providence, Portland, big Providence hospital here. Here's what I found. In 2021, revenue was coming in at $1.040 billion. Operating expenses, $1.008 billion. Operating margin or profit was $31,800,000. And when you roll in money from their investments, they made a total of $55 million. So not so bad. But then look to the right at the next column. And in 2022, Providence Portland brought in $792 million and spent $811 million for a $19 million operating loss. That's not great. And when you take in investments into account, it was a $49 million loss. That's really not great. So the numbers are big, and in some cases they are in the red. Lisa Goodman from the Hospital Association says there are a lot of factors, but the system is under a lot of stress.
Since the first quarter of 2021, salaries and benefits alone have increased by 31%, which really reflects hospitals' ongoing investment in attracting and retaining talent. And this is significant when you consider that for most hospitals, labor accounts for more than half of their operational costs, and for some, up to 60%. So if you're a hospital who is spending 60% of its money on labor, and that labor goes up by 31%, that results in a significant impact to your overall finances. And it is an investment in the workforce, and that's a good thing, but it is putting pressure on our hospitals.
Okay. I was just anticipating some viewers saying, well, then why did they give them those great raises?
Well, we have to make investments in our workforce. That absolutely is important. But we also need our hospitals to be sustainable. So how do you accomplish both of those things? And that's what we're trying to figure out. Hospitals do want to invest in their workforce. That is important, absolutely. But we also need to be able to be financially sustainable and keep our doors open and make sure that we're able to provide care to the communities we serve, not just today, but 5 years from now and 10 years from now. So how do we accomplish that? And that's the question we're trying to answer.
Yep, that sounds like a tough one. All right, now we want to hear from you. After seeing all of that, what do you think? Send us an email, let us know, will you? The address is thestory@kgw.com, or call and leave us a voicemail. The number is 503-226-5090. We love hearing from you. Make sure you write or call. Don't leave us hanging. All right, moving on. Back in February of this year, we told you how a Clark County family was taking on Amazon, suing the company over their teenager's suicide. The family argues that the company was negligent for selling a certain chemical and then suggesting other products frequently bought with it, including a book on how to end one's life. Amazon recently asked a judge to throw the case out. Susanna Frame is in Vancouver with an update.
So we are at a friend's gallery called La Casita.
For the very first time, Tyler Schmidt's artwork is hanging publicly.
He would have been so proud to hold the space.
3.5 years ago, he died by suicide. He was 15.
So I'm ready to share him. And his story.
Tyler was a high school sophomore when, behind his family's back, he created an Amazon account. He bought a lethal chemical called sodium nitrite on the site, drank it with water in a wooded area on his school grounds, and took his life.
I checked on him before I went to bed. I checked on him just like in the middle of the night. Everything that I could think of. But nobody said, did you check his Amazon?
Amazon has been working to quash this lawsuit filed by the family last year that blames the retail giant for Tyler's death, saying despite Amazon's knowledge that sodium nitrite was being purchased for suicide, specifically by minors, they continued selling it anyway.
I will issue a decision.
Now a Superior Court judge has ruled against Amazon. The family can press on with the case.
Very much a relief that it went our way. But I can't live in that space. I have to keep figuring out how to get out of bed.
Tyler's family is one of more than a dozen suing Amazon over sodium nitrite-related suicides. All the plaintiffs argue Amazon was exceptionally negligent for selling veritable suicide kits. When a person bought sodium nitrite, the site suggested other products frequently bought together, such as the Peaceful Pill, a how-to handbook on suicide.
Our babies were important to us, but the money was more important to you. I don't understand. I What business model are they working from?
This is an especially traumatic time for Tyler's family. A major milestone is coming up.
It's Ty's 19th birthday
Another birthday they won't get to celebrate,
on Saturday.
but they'll never forget Tyler's smile, curiosity, and love of art. And they want to make sure Amazon never forgets him either.
You shouldn't be selling those things to minors. And if we have to have a law over it, if we have to take them to court because of it, here I am.
In legal filings, Amazon said it's not to blame for the suicides. It claims the people who bought and then misused the products are at fault. The company has already filed an appeal to this latest decision. By the way, if you or someone you know is struggling with suicidal thoughts, you can get help. Call or text the 988 Lifeline. It's free, confidential, and available 24 hours a day. Again, call or text 988. Moving on to a bit of politics now, it should come as no surprise that our little team here on the story loves digging into data, especially when we're able to put those numbers into visuals to better understand it. That's why this map from DHM Research in Portland caught our eye over the weekend, diving into the votes for the contentious district attorney race last month. The green areas are where challenger and winner Nathan Vasquez did well. The pink areas represent incumbent Mike Schmidt. John Horvick with DHM Research, who created the map, says this reflects a sort of trend that Multnomah County voters have shown in recent years.
We see that Vasquez did well west of the river and really did well east of 82nd in Portland. By my analysis, Vasquez won Portland by about a couple percentage points. He won overall by about 7 percentage points, meaning that he carried so that Gresham, Troutdale, East Multnomah County pretty substantially. And then Schmidt did really well in Inner East Portland. I was interested in this for a couple of reasons. One is just to look at the political geography of Portland and the metro area. And we've seen this pattern emerge and sustain itself over the last several elections. So it's that same pattern where there's sort of a coalition east of 82nd in Portland and west of the river. That's one block of voters that sort of votes together. And then the inner east side of Portland is another. And roughly it's like a 53, 47, 55, 45 sort of split, where so the more progressive candidates, more progressive issues are losing to that sort of east and west, relatively more conservative. I mean, this is Portland, but relatively more conservative group of voters.
Horvick also broke down the vote among the Portland new city council districts. He notes these are estimates since the district split some voting precincts, so imperfect numbers, but you'll get the idea. You can see District 1 in the east was dominated by Vasquez, while Schmidt won Districts 2 and 3 north, northeast, and southeast, but Vasquez carried that 4th district, which is west of the river.
What I think I would want to emphasize to you and to others is that the east part of Portland and the west part of Portland are different in many ways. East Portland is lower income, diverse, less educated, more non-affiliated voters, and they have found coalition with the west side of Portland that tend to be higher educated, higher income, more likely to be homeowners. That group doesn't necessarily have to fit together, but they have found, whether it's the mayoral elections, Renee Gonzalez versus Hardesty, Mingus Maps versus Chloe Daly, that sort of divide has existed in several cycles now.
Super interesting. So what do you think after seeing how the votes shake out in the map of the county? Does it reflect any of your thoughts or assumptions? Surprise you? Let us know, will you? Again, the email is thestory@kgw.com or call and leave a voicemail 503-226-5090. Coming up next on The Story, when was the last day you did not use anything connected to the internet? I'm going to guess that for most of us, it's been quite a while. The internet has become a near necessity for so many of us, and Oregon is poised to get hundreds of millions of dollars from the feds to help everyone in the state get connected. We'll explain when The Story returns. The state of Oregon recently got great news regarding efforts to bring internet to rural communities. This is an issue that many of us in the metro area don't really think all that much about, but if we had our internet access taken away, oh man, we would start to think about it a lot. Oregon was approved for $689 million from the federal government as part of an Internet for All program within President Biden's bipartisan infrastructure package. It's called the Broadband Equity, Access and Development Program, or BEAD. It's a $42 billion state grant program to help states deploy or upgrade high-speed internet services, specifically earmarked for those of you who live in underserved or underserved areas. Oregon, by the way, has 172,000 locations that fall into those categories. The man in charge of the agency overseeing the program calls it this generation's infrastructure moment.
And it's part of something bigger that we're doing across the country. You know, generations before us did very big things. They connected everybody with electricity and water in the country. They built the interstate highway system. This is our generation's big infrastructure moment. This is our chance to connect everybody in the country with the tools that they need to thrive in this modern digital economy.
Now, we're still waiting for an official map from the state's broadband office on where this BEAD money could be used here in Oregon. But they tell us that points on this map give a pretty good idea where Oregonians are unserved or underserved when it comes to high-speed internet. You can see there are some spots around the metro area, quite a bit along the coast in central Oregon, and a whole bunch out east. High speed's coming for all of you. Now that Oregon's plan has been approved, they have 12 months to fine-tune it before sending it back to the feds for final approval. Once that happens, all of the $689 million can and will be released to the state, which will then be spread out among different companies with the goal of getting every Oregonian online.
But there is a lot of work ahead, right? So this moment in the process allows us to say, we've gotten a green light to go out there and develop that grant program to make sure we can provide reliable broadband internet access to all unserved and underserved communities here in Oregon. This is about people. This is about economic development. This is about access to educational opportunities, to healthcare. It's really about the future of our state to get this right. And we are ready to get started at this point, because without access to this key resource, there is no equity. There's no equitable result in terms of economic development. This is the number one issue in my mind for rural economic development in Oregon. And as a Western state, we have a lot of land mass here. So we're going to be creative to make sure we can get to all these communities. Without this money, we would not be where we need to be.
That'll be fun as it rolls out. Still to come on the story, getting a second chance in Silverton. Now, a badly injured puppy in California ended up in Oregon, gaining a loyal following on social media as he heals slowly but surely. Some hope and a reason to smile when the story returns. Our last story tonight is a great example of fate or luck or whatever you want to call it, bringing a California puppy to our neck of the woods. A Silverton Dog Rescue is caring for the little guy after he was found with fourth-degree burns on his paws and legs. What started as a passing glance on social media led to a life-saving decision. We do want to warn you, some of the images you're about to see can be hard to watch. Devin Haskins has our story.
Come on.
The dogs at Woods Creek Rescue in Silverton keep owner Tammy Lilac busy.
Good job.
Especially this one.
You go down the stairs.
A 4-month-old puppy with floppy ears named Phoenix.
Come on. Come on, Phoenix. Come
Phoenix is still trying to navigate the simple things.
I know. Come on.
It's been a rough start to his young
He's a
life.
good boy. He does pretty good.
He came into Tammy's life after she saw him on a Facebook post from a Fresno, California animal shelter. When she initially saw the photo, all bandaged up and needing lots of medical care, she passed him up.
I can't do a medical. I don't do medical out here, and I don't know what changed my mind.
The photo stuck with her, and when she saw it again, this time she changed her mind. That's because the fate of Phoenix had changed.
And sure enough, there was a post with SOS, and I said, without even a second breath, I said, I'll take the burn puppy.
They were gonna put him down.
Yeah. Did you want your breakfast?
Tammy had really never known how bad the burns really were. She had never seen the bandages taken off.
I had them send me his records from there, and I kind of glanced over them a little bit, but didn't really particularly. I was like, you know, pup burn, it can't be that bad.
Except they were. When veterinarians at Oregon State University removed his bandages, she was unprepared for what she was about to see.
It was kind of bad. They were really bad burns.
Fourth-degree burns on all 4 feet, his legs and up his belly. His back feet taking the worst of it.
The back feet, you can't see no pads.
Tammy doesn't know how he was burned or what he was burned with. All she knows is he was found in an alley behind a man's house in Fresno, crying for help, and that the man dropped him off at the vet. KGW News spoke with that guy who said Phoenix had a hard time standing up when he found him.
He was a good puppy.
If this was at the hands of a human, Tammy doesn't understand why.
It has to be a really, really cruel person. I mean, to even think that somebody could possibly injure a puppy.
These days,
You ready? You ready to go for your bandage changes? Come here.
either Tammy or a volunteer will take Phoenix to the vet to get those bandages changed.
You ready?
It's expensive.
We're ready for you guys to come back if you want.
He needs them done about 3 times a week, costing her about $200 to $300 a visit.
So the sedation that we give him.
Because it's uncomfortable and painful to get them changed, he's sedated and won't feel anything other than the first needle poke. This is the 6th time his bandages have been changed since Tammy has had him. He's getting better. It's healing a little bit at a time.
Like that's a little bit of pad material that's coming back.
And as the burns heal, scars will remain forever on this young dog's feet.
So how many more treatments do you think he'll need?
Until all of this scar tissue has covered over his foot. I think we should keep going until then.
But even then, this puppy with the flopped over ears may still need a lifetime of care. Devin Haskins, KGW News.
And Devin says Phoenix will most likely need to wear those booties to protect his feet for the rest of his life. Tammy says in a few more months he should be ready for adoption. But if you're interested in taking the little guy, you'll have to get in line. He's quite the celebrity on the rescue's Facebook page. You can check it out for yourself. Just look at Woods Creek Rescue. In the meantime, that's the end of our show. Thanks so much for joining us and watching. And remember, the story, our collective story, that never ends. This week, we'll have our Digging for Old segment for you on Wednesday, the Juneteenth holiday. In the meantime, Straight Talk with Laurel Porter's coming your way next. I'll see you right back here tomorrow night at 6:30.